Combating caregiver burnout to increase patient satisfaction. This QI project focuses on issues related to burnout in nurses who work in an ambulatory office. My picket question is, for ambulatory nurses suffering from caregiver burnout, how do coping strategies versus no interventions improve patient satisfaction in 3 months' time? Feelings of caregiver burnout include self-reported exhaustion and decreased sense of accomplishment. The nurses in the clinic were asked if they felt these things, and if they did, how often. You can see that 75% of these nurses reported feeling these symptoms of caregiver burnout on a daily basis. Nursing has long been a career that consists of delayed bathroom breaks, overtime, and mounds of paperwork, all while being not only the caretaker, but also the therapist, the teacher, and the mediator. The constant demand to be all of these things easily pushes one to the brink of their tolerance daily and cannot be sustained without intervention. My QI project focuses on these issues related to burnout in nurses who work in the ambulatory office and identifies strategies for coping as well as support needs. Some consequences that may come with not addressing this problem are decreased patient satisfaction, increased staff turnover, decreased morale among all employees, and provider frustration. We all know that bad attitudes spread like wildfire among staff, no matter their assigned job role. Negativity creeps into everyone's workday much faster than positivity and is harder to turn around. It truly is best to work to combat the potential for burnout before it turns into something that cannot be fixed or before patients get hurt. The practice setting that my quality improvement initiative will take place is a multi-specialty ambulatory office with the Cleveland Clinic, Florida. It will be important to have multiple views and inputs, as having a diverse group of nurses will allow us to reach more nurses with our initiative. The population of focus for the initiative are the nurses who work in that capacity every day in their assigned job roles. While the stakeholders include more than nurses, such as providers or physicians and the nurse managers, the nurses doing the day-to-day nursing role will be the focus and the population most affected by the problem of nursing burnout. The role of the professional nurse in addressing the problem of nurse burnout will start by getting input from nurses performing that nurse role to find out their thoughts and feedback on the issue at hand. The next step is identifying the interventions and then implementing those interventions. After a specified time frame, there must be feedback gathered from those nurses and staff impacted by the implemented interventions to see how they are working, as well as a close follow-up. The professional nurse must be the one to oversee and identify any concerns and needs for changes. The evidence integrated for this project is focused around the Cultural Change Toolkit that helps to identify ways to provide the recognition and leadership support that the nurses and staff crave to combat caregiver burnout. The initiative that was identified for this project is the creation of a kudos board where caregivers can quickly and easily give kudos to their team. The other initiative will be leader rounding, allowing for daily visibility for caregivers to boost the sense of support. This small gesture of giving kudos on the kudos board makes a large impact for those being recognized, while also allowing the person giving the kudos to feel a sense of satisfaction for contributing to the self-worth of others. The board is posted in a common area with a lot of foot traffic so that it is easily visible for everyone. The leader rounding will support the caregivers by allowing them to see their leaders in the departments daily. This also allows for better recognition of any issues or concerns and quicker resolutions. The team for this QI project includes a nurse and a physician from each of the following departments: primary care, general surgery, and gastroenterology, as well as the nurse manager, the operations manager, and a senior office coordinator for when the operations manager is not available. The perspectives from each of the different team members will allow for different real-time viewpoints and feedback on both the issue at hand and suggested or identified processes. The operations team can also help to identify the cost concerns for the office and organization, and the nurse manager can assist with the anticipated impact to the entire office. Cotter's change theory provides the framework for the process in this QI project. Specifically identified are the create urgency and to have small significant improvements, which will help to both make the project successful and for sustainment of the initiatives. My plan for the implementation of my QI project included a period to teach and share information about the reasoning behind the project with the nurses and the office staff so that there is understanding of what we are doing and the goal we are working toward. The creation of the kudos board and its placement in a high traffic area, encouraging the use of the kudos board while also allowing for quick and easy recognition of their team. Daily rounding by leaders starts with a quick explanation of the what and why to explain why leaders are walking around every day asking how the team is doing. Discussion at daily huddles will also help to encourage participation in these conversations. Using the patient survey, Press-Ganey, to capture a before picture of patients' perception of the nursing staff is essential to verify an impact from this QI project. As you can see, we are under 80% for patients who feel their nurse showed true concern for them before the QI project. This project is very cost effective in that there is only the cost of the kudos board itself as well as the ballots for staff to write their kudos and then attach to the board for the office to view and acknowledge. So in this case, the resource needed to implement the plan is human capital, meaning someone to advise the staff on how to utilize the kudos board, and then of course the physical board itself. Health information technology can be utilized when processing feedback for the QI project and implementation. We can utilize charts or graphs to demonstrate the feelings of being stressed and overwhelmed before the kudos board versus after implementation. Being able to physically see the difference will have a better impact than leaders telling them what the differences have been and what improvements have been identified. Training needs for the QI project will not utilize technology as the kudos board will be on the wall and the staff needs to fill out the ballots and then attach them. I had a goal to make this initiative as easy as possible to complete to have significant participation. There will need to be persistent adaptations with possibly new ballot sheets monthly or maybe incorporating a contest occasionally to entice the office staff to continue utilization of the kudos board. Technology can be brought into the project when we are looking to poll the users who used or experienced the interventions and the impact they had, as well as using visualization with graphs to display the improvements identified with the QI project. The strategies used to promote and encourage an environment of safety are to ensure that the team is familiar with the code of conduct and the policies set in place by our organization. It is important that everyone be aware and understand what is expected of them and that they will be held accountable for embodying those standards. The team must also feel empowered to identify and report any event that may cause harm of any kind to both patients and their peers. The goal of my QI initiative was to decrease the stress and overburden that nurses feel in their current job roles. When we look at the Press-Ganey scores after the implementation of the QI initiatives, you can see that all percentages went up. Notably, the feeling of concern by nurses felt by our patients is now over 80%. The same 60 nurses were polled after the QI initiatives were implemented, and while there is only a small change in the percentages, these changes are all positive. Only 63% versus 75% reported feeling those feelings of caregiver burnout on a daily basis after the initiatives were implemented. The kudos board is hung near the break room where it will get the most foot traffic by all team members in the building. As soon as the kudos board was hung, the staff started utilizing it immediately. On the kudos board, there are some notes that are small books and some that are 1 to 2 words, but all are encouraging and uplifting. Watching the team stop to read them or write one is awesome. Quality improvement is an important part of any QI initiative, as there should be a goal to make things better no matter the subject of focus. For this particular initiative, the focus to help nurses overcome caregiver burnout, and while this goal is accomplished, there is also the achievement of increased patient satisfaction and quality of care. This initiative will work and will be effective, but it will also take continued support and encouragement from leadership to sustain. The result is not only to reduce caregiver burnout, but by doing this, we will increase the quality of care we are providing to our patients. This QI project identifies a concern for nurses and caregivers worldwide. Burnout is real and is felt by so many, and to such extents that they have even left the medical field altogether. The initiatives in this project are simple, cost-effective ways to make a significant impact on nurses who may or may not be suffering from burnout. Either way, the recognition and support needed are essential to ensure our nurses understand their value and their impact on the delivery of patient care.